So today, for patients with stage 3 non-small cell lung cancer that's considered non-resectable, standard of care is still concurrent chemo-radiation therapy followed by consolidation immunotherapy. However, with neoadjuvant chemo-immunotherapy approaches, these therapies today, they can offer potentially a different approach for patients that are borderline resectable, but possibly also for a small fraction of high selected patients that are considered today non-resectable. And so in this study, we really set out to address the question, can we use neoadjuvant chemoimmunotherapy in real world for patients who have unresectable or borderline resectable stage 3 non-small cell lung cancer? And in this study, we did identify 112 patients who had stage 3 borderline or non-resectable non-small cell lung cancer. That means they had a T4 tumor with or without N2 or N3 nodal involvement. Of these patients, 112, 75% ultimately were able to undergo surgical resection. So all these patients were treated with neoadjuvant chemoimmunotherapy, and approximately 75% did receive a surgical resection, which was successful. Of these patients, of course, our interest was looking into the complete pathologic response rate, the major pathologic response, and ultimately also the event-free survival. And it was interesting to learn that the complete pathologic response rate was 29%, not too different compared to the PCR rate we have seen in stage 2 to 3B resectable non-small cell lung cancer in landmark clinical trials. The MPR rate was 42%, and the event-free survival was approximately 52 months. Certainly pretty impressive event-free survival. These are retrospective studies, of course, with many bias, but still, it does challenge the current standard of care for a fraction of these patients with borderline or non-resectable lung cancer. And future trials, some of which actually have been presented at this meeting, are currently converging towards the idea that this should be an approach we could consider for a small fraction of these patients.